I think we were 23 or 24 when we first started thinking about entrepreneurship in real. All of us basically engineering geeks to a certain extent, wanting to really build stuff to change the world.
And we all used to hang out, during nights, jamming sessions on data and business and entrepreneurship. And then, one fine day we said, hey, we have a big problem to solve. Organizations were storing so much data that they did not know how to organize.
We started with finance, we were in retail, we were also in healthcare as one of those markets. But the problem that we very soon ran into was that the moment we tried to go one layer or one level deeper into the data problem, it would get heavily contextualized by the market itself.
So we realized if you need to solve data, you need to be in one business, and that was healthcare.
So we shut everything else down and decided to focus on this one problem, bringing the patient context onto one common platform and making it available for all caregivers across the continuum of care.
We deployed a bunch of engineers as well as data geeks who could help figure out how do you pull data, how do you structure standardize it using machine learning, NLP, AI, and all those kind of cool techs, and then bring it into this unified patient record or a patient 360, what we would call, and then enable all downstream kind of application and analytics access on top of it.
As we did that as the first step, right, we started realizing that we need to start building applications for every stakeholder. How do you disseminate this information to every stakeholder that's caring for you? So we started building tools like InCare, which was how do you coordinate care better? Then we started thinking about how do we put this information in front of doctors. Then basically we started building out like a patient application that you are responsible for your own care as much as your doctor is, or as much as the care delivery framework is.
We want to be the ubiquitous platform that is powering all those innovations across the healthcare ecosystem. And at the center of it is the patient who is getting better care and a better coordinated care because of everything that we are able to do around them.
We know that there is $1 trillion of healthcare wastage every year, and we have only solved for $1 billion plus. That's 0.1%. We will reach to 1 to 2% at max by ourselves. But because we have this amazing platform on which workflows and innovation can be built, we don't want to expose it to only our engineers. We want to expose it to all developers out there in the community to say, come and build on top of us. Let's make that 2% wastage reduction to 25% wastage reduction. So the future of Innovaccer is about 10 times more lives, 10 times more data, 10 times more customers, and about 100 times more innovation by our developer community coming on top of us.